All right. How you doing, Dr. Wolf?
Good. How are you?
Oh, I'm doing fantastic. Actually, I just landed in LA, doing several events here for some customers and enjoying this nice weather.
Good.
Awesome. So, just want to say welcome everybody. Just want to welcome everyone to Ask the Insider, the Instagram Live. This is featuring Inside Asthma Peak Week. And I'm your host, Derrick Varner, better known as Professor Derrick Varner. I'm a clinical educator with Thermo Fisher Scientific, and I'm here with Dr. Garen Wolff. And so, Dr. Wolff, if you could just share with the audience just a little bit about yourself.
Of course. So I am Dr. Garen Wolff. I am the Chief Allergy Immunology Physician of Wolff Allergy and Asthma, located in Detroit, also known as the Motor City,
Yes.
also known as Motown. I have my own private practice. I am the only allergist immunologist in private practice in the city of Detroit, where I am from.
All right, fantastic. I got excited when you said the Motor City. I
Of
like
course.
listening to some smooth music and relaxing. So, hey, Dr. Wolff, if you could, before we get jump too deep into the subject right now to discuss, if we could just level set and share with some of our first time listeners, what is asthma?
Sure. So asthma is a chronic, that's a big word for long-term disease of the lungs. So the lungs are constantly inflamed, or shall we say hypersensitive. So what exactly does that mean? Well, people with asthma, their lungs are easily triggered by factors in the environment, pollen, animal dander, cat, dog, even fire from a campfire, perfumes, and often as people with asthma can really be triggered by colds or viruses. So asthma, there is no cure for asthma, but there's good news. Asthma can be exceptionally controlled with medications, lifestyle changes such as weight loss. Uh, Obesity can affect asthma, not smoking cigarettes or vaping, and controlling triggers such as allergies.
Hmm. Oh, wow. Fantastic. Let me ask you this. What are some of the common uh, asthma symptoms that a patient may present to you, complain about, or they may be experiencing?
Great question. So there are four big symptoms: cough, and that cough is particularly worse at night, and it actually can wake them up in the morning. It's interesting because some patients can present only with a cough. The
Hmm.
second is wheezing, and wheezing you can have a whistling noise. The third is chest tightness, chest heaviness, sometimes even chest pain, and then shortness of breath. And any of these four symptoms can happen at rest, so when you're just sitting, or they can happen during physical activity.
Gotcha. Yes. And let me ask you this. I know some of our audiences out there. How is how does one diagnose asthma and how is it confirmed from a medical standpoint of view?
So, clinical history and symptoms, like the four symptoms I mentioned, shortness of
Hmm.
breath, wheezing, chest tightness, and cough, are really key to diagnosing asthma. Why? Because the lung tests that we use to diagnose asthma can sometimes be normal in people that are very well controlled with asthma. Maybe they were diagnosed with asthma. Or recently, and so the test can be completely normal. So the two tests that we use to diagnose asthma, the two tests are spirometry and pulmonary function test. So
Okay.
spirometry, I actually perform spirometry in my office because the machine is quite compact, it's small, and I can move it from I can carry it like with one hand
Hmm.
from one room to another room. And so what patients do is that I give them a disposable mouthpiece, and they blow into the mouthpiece as hard as they can, as hard as you can, like you're blowing out the candles on a birthday cake, but you get those trick candles that don't ever, go out. So they blow, they blow, they blow, they blow, and then I tell them to, while the mouthpiece is still in their mouth, to take a deep breath in. And that spirometry machine, that compact machine, actually measures how much they breathe out and they breathe in. And I can tell them on the spot how their asthma is doing. The second test is the full pulmonary function test. And this test, for those who've done it for the first time, can actually be a little fun. So you usually do a pulmonary function test. I know it's surprising. So you actually do a pulmonary function test, usually at a hospital. And what happens is they put you in this airtight booth, like a telephone booth.
Mm-hmm.
And the tech person will tell you to breathe in and breathe out, kind of like what you would do in my office. And the pressure in this airtight booth helps measure your lung volumes, and that gives a greater picture for your lungs. So we use clinical history and the symptoms: shortness of breath, wheezing, chest tightness, cough. Plus, we look at those two lung tests, spirometry and the full pulmonary function test.
Wow, that's very helpful. And hopefully that
Mhm.
will get somebody and inspire someone. If you are having those symptoms, make sure you follow with your primary care provider or allergist or pulmonologist to get that evaluated. Dr. Wolff, let me ask you this, and I know inquiring minds want to know how many people in the US are affected by this chronic inflammatory disease, and is it increasing?
So asthma, at this time, it's around 25 million people in the United States alone are affected with asthma. And the asthma rate is increasing. We have more pollution in certain cities. Detroit, like my city, the Motor City, California. And so the asthma rates are definitely increasing because of environmental issues as well.
Hmm. Wow, wow, interesting. And you mentioned California, and out here with a lot of people, population growing. Yes, I can see that happening.
Yes.
Exactly.
Yeah.
Let me ask you this. Can you share with the viewers what is at the core of what we call asthma peak week, and why is it somewhat the perfect storm for people with asthma and allergies?
So, Derrick, right now, we are currently in the midst of Asthma Peak Week. And like you said, what exactly does that mean? Well, Asthma Peak Week was determined the third week of September because it's this time that people have a lot of asthma flares. They go to the ER, they go to the hospital, and then it actually tapers down towards October. And so the question, which is what you mentioned, is why this week of all weeks in a month? Why not around Christmas or in the spring? Or, why exactly? Well, there are a couple reasons. Number one, back to school. We've seen all the back to school commercials. Kids are back in school, and a lot of schools, they put in new carpet in the classrooms. They have new construction. You have buses now that are outside the school, and you have the fumes from the buses that are in the air. So that can trigger kids and people in general. Two, for children in school, you have a lot of germs and viruses you get from your lovely classmates, your lovely new friends, but you also get from the weather too. And that's also with adults. You have more people at work. Your work may be more consistent. You have a more consistent schedule. You're coming into the office, so you can get colds. The third reason just could be the ragweed and the mold in the air. We're talking fall time, and so that can trigger people as well. And then, summertime is summertime, and during summertime, we do everything that we couldn't do. We go on a vacation, and sometimes we go on a vacation travel, and then sometimes we go on a vacation with our medications. So we don't always take them because our symptoms aren't bad, or it's not that bad. Let me jump in a pool. And so sometimes when you're out of the routine of taking medications, that can carry into the fall as well. So those are some of the reasons.
Gotcha. Thanks, Dr. Wolff.
Mhm.
And you
Of
know what?
course.
I can recall a time, uh, actually right now, right? I was just seeing patients last week and actually right before I came out to California, and I'm getting more requests on patients requesting, give me a school note so I can go back to school because I was out
Yeah.
for a couple of days, or work note, hey, I need a work excuse note to go back to work because of my asthma exacerbation. I had to go to the emergency room, or I was hospitalized. And so,
Mm.
interestingly, I've noted that across the U.S., they said on an annual basis, about 10.5 million school days are missed annually due to asthma for the kids. And
Believe
also
it.
14.2 million work days are missed for asthma. That's due to asthma related. So it's a problem. So with it being a problem, let me ask you this. What are some of the costs associated with asthma?
So the cost for asthma is really, in the billions for asthma. And
Mm,
why is that? Well, number one, medications. The medications for asthma can be very expensive for anyone, especially inhalers in particular. So first, just medications in general, number one. Number two, medical bills from going to the ER, from going to the hospital. That is very costly as well. And then third, the cost, which may not be completely able to be tallied, but just the cost in general of missing work days, missing school days as well. So asthma is not only affecting someone's quality of life, but it's also affecting our economy overall.
yeah, and you mentioned that. If I could, I want to share with you now that you're talking about missing and the cost. I remember
Mhm.
growing up on the west side of Chicago and some of the low income housings at that time, and I recall some of my cousins when we would go out and to play. There would be
Mm.
challenges for them to keep up with us riding bikes or running. It can be certain parts of the year with shoveling snow, being in the cold, or doing some parts of the year like spring and summer where they just couldn't keep up with us
Mhm.
because they for one sometimes the medications were expensive, and so it was a challenge. And now I look back and I'm like, oh wow, my cousins they were really struggling with
Mhm.
this diagnosis that they couldn't afford or was underdiagnosed and we couldn't get them to see a provider. So it is a problem. Let me ask you this. What can you suggest to be done to reduce or eliminate a patient's odds of having a asthma attack or exacerbation that can lead them to go to the urgent care or emergency room or even being hospitalized during this time of the year?
So the question is, do they know if their asthma is controlled? And many people think that their asthma is controlled, or what I find is that they just deal with the symptoms, just deal with it. And so I'll ask a patient when I see them for the first time is, how do you think your asthma is doing? Do you feel like it's controlled or you don't feel like it's controlled? And many patients will say, oh, it's okay. So over the years, science has developed two different ways that you can determine whether your asthma is controlled, whether any provider that you see can determine if your asthma is controlled. There are two. Number one is the asthma control test, the ACT, and that's not the ACT that college students take that I took years
Yeah.
ago, not that many years ago. But anyway, so there's the ACT, and then the second is the Baylor's Rules of Two. Now, depending upon where you practice in the country, you can choose either the two of those. I personally have the asthma control test in my office. I have it on a clipboard. So when patients
Mm,
see me, either for the first time for asthma or a follow up, before we say hello, well, of course, I say hello. After that, I give them the clipboard and we review those four questions. So what I ask them is, number one, in the past 4 weeks, how often have you had symptoms during the day of the four symptoms we discussed, Derrick, which was shortness of breath, chest tightness, wheezing, and cough? And they'll say however long. And I'm looking for, was it more than twice in a day or more than twice in a week? The second question I ask is, in the past 4 weeks, how often were you awakened in the middle of the night with any of those symptoms? The third question I ask is, do any of those symptoms, shortness of breath, wheezing, chest tightness, or cough, interrupt your physical activity? Does it limit your physical activity? And then lastly, I'll say, in the past 6 months, have you been to the ER, the hospital, or have you been prescribed oral steroids? And so that's how I determine um, if their asthma is controlled. And when you give the asthma control test, if your score is less than 19, that shows that you're not controlled. So when patients look at the numbers that they usually circle a number, it's like 1 to 5, and they calculate them, and then they see 19, we say, okay, we have some work to do. And many times I'll ask them, if they do use their inhaler, why are they using it? Why did you grab it? Did you grab it because you had chest tightness? Did you grab it because, I just like grabbing my albuterol inhaler? I have a patient who he just loved to use the inhaler just because he out of habit. And I'm thinking, what? But so his asthma control test score would be off because he just said, I just like grabbing it and I like the way it feels. I said, okay, but do you need it? Nah, Dr. Wolff, I really don't need it. Okay. So that's why, when you ask these questions, you should ask people to explain, why did you go to the ER? Or why did you use your albuterol inhaler that day? And sometimes if you find that patients are using their albuterol all the time, they'll say, well, I'm using it right before I exercise. Okay, that's an appropriate use, as opposed to I'm grabbing it because I'm short of breath. So when we ask these questions, we also have to take other questions in our mind, into consideration.
Gotcha. Yeah, thank you for that. And hopefully
Mm-hmm.
the viewers out there that may be plagued with this condition or have a loved one, please make sure you use that information that can help you. Dr. Wolff, let me ask you this. Could you talk to us about the various methods that you as an allergist use on a daily basis? And also what's available to primary care providers like myself to help our patients determine what allergens that they may be sensitized to?
Definitely. So there are 2 ways that I test for allergies. The first one is a skin test. Now, with the skin test, I scratch the skin with a particular allergen, such as a tree, grass, weed, mold, cockroach, dust mite. So my allergy panel is 46. So I actually scratch the back 46 times. Now we never break the skin. We don't break the skin. It's just scratch on the skin.
Mm-hmm.
And then within 15 minutes, boom, I can tell you if you're allergic. And so you'll have a bump that looks like a mosquito bump sometimes, depending upon the skin tone. It could be red, sometimes it can't be red, but it will also be a little raised, meaning you can feel it's not going to be flat on the skin. So that's a skin test. The blood test, I put in the order. It's also called immunocap. Immunocap's the other word for that. And I have my same allergy panel, but also through immunocap. And so both skin tests and blood tests are equally accurate. So you can either have your skin tested or you can have a blood test. The difference between the two is that with skin testing, you have to hold your antihistamine. We're talking Zyrtec, other name for that is cetirizine, Claritin, other name for that is loratadine, Allegra, and so on. You have to hold it 5 days before testing. Because if you take any of those antihistamines, Claritin, Zyrtec, Allegra, then it will completely block the response, which means when I skin test you, it would be completely normal, which makes sense because it's doing its job, right? Allegra, Claritin, they're doing their job. They're preventing the allergic reaction. Now, I have some patients that say, Dr. Wolff, there's absolutely no way I can get off my Zyrtec or my Claritin. I'll be miserable for 5 days. I can't do that. No problem. Now let's do immunocap. Blood test instead. You don't have to hold any of your antihistamine medications. It takes a couple days for the results to come back, but it's just as accurate. When it comes to primary care providers, what I would say is make sure to get a very good history about their symptoms. Do they have runny nose? Do they have stuffy nose? Do they have postnasal drip, which is liquid down their throat? Is it worse in the morning or at night? Usually if people are saying they're stuffy when they wake up in the morning, their head is rolling around in dust mites, which are these microscopic little bugs that you can't see by the naked eye.
Right.
They're odd. But
Yeah.
anyway, they live in humid environments. So a history is very key.
Mm-hmm.
You can order an allergen panel. You can order immunocap, but make sure you know how to interpret that. because I do have a lot of patients who come to me because the allergen panel was not ordered correctly. And how do we know if it's ordered correctly? Well, the body, and I'm not going to get into all the details, there are 5 immunoglobulins that your body has. And the immunoglobulin that detects allergy is called IgE. So when you have an allergic reaction, your body generates this molecule called immunoglobulin E, which is too long for me to say, so I'll just say IgE. So both the skin test and the blood test detect IgE. So if you decide, Derrick, you would like to, for example, there are only about 3,000 practicing allergists in the country. There are not many of us. It's very hard to get someone in to see an allergist. If you'd like to order a panel, I would recommend the ImmunoCap. It would be an IgE and not an IgG. So I think that is very helpful for ordering.
Yeah, that is so helpful and hopefully inciting, and try to say that 5 times straight, right?
Yeah.
Uh, hey, Dr. Wolff, there is a question on the line, and I want to ask you that, but I have another question first. So the question that's come through, it says, can food allergies also cause an asthma attack?
Yes, yes. In fact, people with food allergies can have worse asthma attacks because when you have a food allergy, the symptoms for food allergies can be hives. They could be shortness of breath. They can be wheezing. And if your lungs are already a little sensitive to those things, then when you have a food allergy, it can definitely get worse. And if you are a patient that has environmental allergies, meaning allergies to trees, grass, weeds, and you also have asthma, you have that atopic march. That's a big word for allergic march going on in your body, which means you also may have a food allergy. And the common food allergies are peanuts, tree nuts, shellfish, such as lobster, crab. So definitely a food allergy reaction can lead to an asthma attack.
Gotcha. Thank you, Dr. Wolff. Let
Mhm.
me ask you this. Why is asthma important to you and your patients as an allergist? Why is this so important to you?
For a couple reasons. First, asthma can be controlled. No child or adult should die from an asthma attack.
Hmm.
And the inability to breathe is pretty frightening. I do not have asthma, but I know how it feels to feel like you're drowning in a pool. You jump in a pool, you feel like you're drowning. I couldn't imagine how horrible that feels to not being able to breathe. And that's very frightening. And that really impairs quality of life for people. And so I can control asthma. Asthma can be controlled. I will work with you. I've got the tools. And so that's why it's so important. That's why it's so important to me is that asthma really affects quality of life. And as an African American, as a person of color, a lot of people of color, African Americans, Latino or Latinx, Native Americans have higher rates of asthma. They die more frequently from asthma. And so I would like to reduce those numbers. And so asthma is important to me from a general perspective of it can be controlled. No person in the United States should die from asthma. And number two, as an African American, I want to make sure that my community, people of color, and also in general, people of color are taken
Yes.
care of.
Gotcha. That's so important. And as you stated that how many people die every day, it doesn't
Mhm.
get the attention that some of the other comorbidities like
Yes.
cardiovascular disease or cancer, but it was stated that about on average 10 people die in the US from a asthma attack. And
Yeah.
the incredible thing is preventable, right? So with that being said, what are some of the common factors that can lead to some of the asthma disparities in the US? What have you seen?
Sure. So first is income.
Yeah.
We touched on this before about how allergy medications can be very expensive. And
Mm-hmm.
what I have seen firsthand is that patients will not they will not follow my prescription in its entirety, meaning you're on a certain inhaler, I prescribe 2 puffs twice a day, but
Yes.
they'll only take 1 puff once a day because they're trying to conserve the medication because it's so expensive.
True.
So definitely income, number one. Number two is access to care. Some people have transportation issues. They can't make appointments. And when you can't make appointments, you can't have a regular follow-up. That's the first part. And the
Mm-hmm.
second, how can you go to the store to buy your medication? So you can't see your provider regularly, and you don't have the tools, meaning the medications, in order to help you keep it controlled. Third is education. You want to be with, and Derrick, you know this, you want to make sure that when your provider provides your directions for you, make sure to ask, to explain, because sometimes we think that what we prescribe makes sense. That this is an easy inhaler to use when really there are like 7 different shapes. There's one, you pull this back and you got to put this one in it. The other one, you click here and I mean, it's a mess sometimes. So, so you want to make sure that, as providers, that we make sure that we explain to the best of our ability. And sometimes we don't have time to, et cetera. And sometimes people cannot read. We have illiteracy rate, meaning not being able to read, is very large, and some people won't tell you they can't read, and so that contributes to disparities. And if English isn't your first language, that's difficult too. Being able to find a translator to find those services. So those are some of the reasons, but there's so much more that causes asthma disparities.
Right. Thank you for sharing.
Of
Um,
course.
we get ready to land this plane in a little bit. So the other question I have for you, what educational resources or some of the websites that you encourage your patients to use to learn more about asthma, allergy, some of the solutions to some of the environmental triggers such as dust mites, animal dander, mold, and more? What's some of the resources you use or recommend?
So this is my second time being a guest with Allergy Insider. So I'm really glad they brought me back. And I followed them since the first time that they contacted me. And I will say that Allergy Insider provides outstanding information for causes of allergies, causes of asthma, allergy triggers, etc. They will highlight the asthma triggers, the viruses and the pollen. And so I definitely encourage you to follow Allergy Insiders, number one. Number two, I am a member of the American Association for Allergy, Asthma, Immunology. In fact, I'm on their speakers bureau. And so AAAI, there are 4 A's and an I.org, I believe, either .org or .com. I can't remember, but it's one of those two. And then there's the American College of Allergy, Asthma, Immunology. And then you can follow me, of course. I completely forgot about myself. So you can follow me at Wolff Allergy. And I have a YouTube channel where I talk about very, very short blurbs about different allergic topics, like 2 minutes, 3 minutes.
Well, thank you for that. I'll make sure I'll be able to tune in and listen and follow you as well so I can learn more and stay up to date. Doc, before we tune off, there's a question that came in the comments. Is asking, is asthma anxiety real, or can one get anxiety from having asthma?
Yes. So when we talk about if a patient is controlled, we think of all the different factors as to what can make a person not controlled. When I go through that asthma control test, why is that number 19 or less? It could be because they don't know how to use the inhaler. It could be because they have allergies that they never had treated. They can also have some anxiety. And anxiety can make asthma worse because one of the 4 main symptoms we mentioned is shortness of breath. And if you have anxiety, you can have greater asthma symptoms just because of that, if the anxiety is not controlled. So I always ask patients, especially those who have told me that they have a history of depression or anxiety, I always make sure that is just as important to pay attention to than it is the dust mite and the cat dander, as well, that affects them.
Gotcha.
Mm-hmm.
Well, just wanted to say thank you. I think there's one other one. Okay, yeah, I think that takes care of all the questions. Just want to say thank you so much. And I just want to leave this call to action to our viewers. Just want to let you know that both children and adults during this season and beyond, you can do something to protect yourselves and your loved ones. And that's definitely preparation is the key. And Dr. Wolff kind of outlined what does that look like. And so we want to thank you for joining us this afternoon. Enjoy your day, enjoy this week, and enjoy this season. Until we meet again, join us on Allergy Insider. Okay? Thank you so much. Thank you, Dr. Wolff. Any other
Thank
closing?
No, you can follow me at Wolff Allergy, 2F's Allergy, and my YouTube channel. Or if you're in the city of Detroit, come on by. I'm in the Fisher Building, home of the Fisher Theater, Suite 210, and I'd be happy to take care of you.
Outstanding. Once again,
And you
thank
can visit my website, sorry, wolfallergy.com.
yes, that's it. There you go. Say it one more time, Doc.
Wolff, 2F's. I've got that extra F, which means that's special, allergy.com.
Thank you so much. I appreciate that. And once
Thank
again,
you.
all viewers for chiming in, listening in. See you next time. Stay tuned, stay connected with us, and we'll see you next time. Take care.
Bye.